Hello, everybody. Welcome back. So, of course, Andrea Twarowski here with Dentalelle Tutoring. Now, I know all of you love mock exam questions, right? Right? Because that's how you truly know if you're actually understanding something. Because the board exam isn't verbal, it is multiple choice type questions. So, I know you all think you know the answer for a lot of things, but on the board exam, you need to pick the best answer. And two answers, honest, are always correct, but you have to know and pick the most correct. So let's just jump right into it. I'm going to be going over some mock exam questions with you, and I'm going to be talking to you about why it's the best answer opposed to some of the other answers that may be right and may be correct, but they're not the most correct, because I want to train you guys how to see these types of questions and types of answers for the board exam, because they don't try to trick you, but they're hard questions, and it almost seems like they're trying to trick you sometimes, and you're probably shaking your head thinking, why can't you just have one correct answer, right? So anyways, let's talk about it. So I'm going to share my screen. So let me just move my mouse closer to me here. And let's share my screen here. So this is a little bit from my 2015 package, my mock exam study package. So let me just make the video bigger because I look really tiny right now. There we go. Okay, so let's talk about a few of these questions. So I'm not going to go over all of them, but I'm going to go over the first couple, and then we'll see how you guys do. And I'll say it again, if you have questions, you guys, please email me because I am happy to help. I have been getting a lot of amazing emails so far, which makes me so happy. And in fact, some of you have even signed up for the Board Exam Prep Academy, which is awesome because we hold live tutoring sessions twice a month, and in our private Facebook page, there's always something new, and I'm putting up new things there all the time. So okay, so let me just cancel out this Facebook message. There we go. So is everybody ready? So let's talk about these questions here. I'm just kind of moving my video screen now so I can see the questions. Okay, so question number one. Francesca is a new client of yours and you want to be culture sensitive to her needs. She is fasting and mentions to you she would prefer you didn't use any water while debriding today. How do you respond? So this isn't a dental assisting type of question. This is for those dental hygiene students out there. Now, this is a perfect question because this will happen. This is a perfect example of what could happen to you in the office and the type of question that's on the board exam. Because if you notice, in the question, she's talking about a couple different things here, right? So you, A, have to know what culture sensitive means. You have to know what the term means that she is now fasting, and you have to know how to respond to this. So I guess I should have hid the answer first, so I apologize, but let's talk about it. So obviously the answer is C, but let's talk about A, B, C, and D first. So A, so you would tell her you will be careful, but you do need to use a little bit of water. You, B, mention you will ensure the water is warm for her. C, create an open-ended discussion, encourage her to discuss her cultural background. Or D, avoid any further questions about her cultural background. So I feel this is kind of an easy question because to me it's pretty obvious what the answer is. So the answer is C. Create an open-ended discussion, encourage her to discuss her cultural background. So even if you didn't understand what her culture is, that's fine, but it doesn't hurt. You need to ask the question. Don't pretend to know. Don't say, oh, well, I'm new here. I need to use water, so too bad. You know, you can never say that. So even if you're not sure, create an open-ended discussion with her, which means also you need to know what open-ended means. So it doesn't simply mean asking her questions and she gives you yes and no answers. That's a closed open-ended type of discussion. You need to ask her questions that will encourage her to open up and sort of talk about her cultural background if you're not sure. So let's just say you didn't understand her culture and you don't understand why she can't use any water, or she can't have any water. That's okay, but then you need to say to her, okay, you know what? Sure, I completely understand, but you know what? I'm unfamiliar with why I can't use any water today. Do you mind talking about that with me so that I can understand for next time, and so I can understand for my other patients also who may have the same thing, you know? So never say like, well, no, I don't really understand, but it's always a good idea to create, and I'm sorry to continue to repeat myself, but it is so important to create that open-ended discussion, especially when you're talking about different cultures. On the board exam, anytime they mention culture or community culture or different nationalities, think right away you want to create open-ended discussions and you want to be open to their culture. You may not follow their you may not follow what they believe in. You may not be of that nationality, but you still need to understand. You need to be open. You need to be professional. So always keep that in mind. So I do have the rationale here for you. So you always want to be culture sensitive towards your clients. There is never any harm in asking questions, and it will show your willingness to learn. Avoiding questions will promote frustration. And keep in mind that also many cultures are different. So eye contact, handshakes, hugs, loud voices, etc. may not be acceptable. So you have to be careful with that. So if you're the type of person that likes to hug your patients, which you shouldn't, but anyways, that's not always a good idea, because in some cultures that's not okay. In some cultures, a female can only treat a female and a male can only treat a male, or the other way around. So it's so important that if you're not sure about cultures or community, look this over in your textbook, because they will likely have these in case study types of questions on the board exam. And of course, if you need help, I go through all of this in the Board Exam Prep Academy also. But so yes, so, and I have had this actually happen where I have had patients say, you know what, I can't use any water today. So if you need the water for rinsing the polish or using the piezo or the ultrasonic, I just simply can't. In some cases though, they can have the water, but they don't swallow it. So you need to make sure to have the suction in there to suck up all of the water, because they just can't swallow it. So it depends on the patient. It depends on, you know, who you're seeing, and I guess how devoted. Well, that's not a good word. I'm not trying to say how devoted they are, but some patients are okay with the water, because I have had this, but they can't swallow it. So just kind of keep that in mind. Okay, I think I've talked about this question enough, but you get the idea. If you are a student of mine inside the Board Exam Prep Academy, you know I like to talk, so thank you for your understanding. But okay, let's go over the next one here. So, number 2, and again, I probably shouldn't be showing you guys the answers, but anyways, so number 2, so Mrs. Lucia, age 47, wants to show, or wants you to know she brushes with baking soda and water. She says she has been doing this since she was a teenager. She has never used toothpaste. You notice she has some extra staining on her teeth this appointment. What do you do? So this could be for dental assisting, this could be for dental hygiene. So let's read the answers first. So A, so let her know that brushing with baking soda and water can cause stain. B, let her know there is not enough evidence or research to show any pros or cons to this technique. C, let her know that Crest toothpaste is best in her condition. Or D, talk about smoking cessation techniques. Okay, so the correct answer is B, and I'll tell you why, okay? This is taken from the Mosby's, I believe. Not this exact question, I modified it slightly, but there is not enough evidence or research out there, plain and simple, that talks about baking soda and water. So A is not the right answer because we don't know that baking soda causes stain. We don't know that, right? Because there's no evidence showing that. So we can't be telling her that. Yes, it says that she has more staining than usual, but that doesn't mean that it's from the baking soda and water. And she has said that she's never used toothpaste. She's always used baking soda and water. So the fact that you had noticed extra staining this time probably isn't from the baking soda because she apparently has always used it, right? And C is not the right answer because typically on the board exam, if they talk about a certain company, that's not the right answer because we're not here to tell people to use Crest or to tell people to use Colgate or Listerine or Pro Health Rinse or whatever. We are just here to tell them about the best types of toothpaste for them. So if they have, let's say, sensitive teeth, we might say that Sensodyne is a good option for them, but on the board exam, they don't want you to say Sensodyne, but they might say use a sensitive type toothpaste for sensitive teeth. So they won't specifically say a company because it depends on where you live too. You may have never heard of Sensodyne or Crest or Colgate or something. So they try to make the board exam adaptable to everybody. So if you see, and I can't say for sure, but typically if you see a certain company like Crest in the answer, that's probably not the right answer because they don't want you to think specific to a specific company, if that makes sense. So C is not the right answer because why would Crest be the company for her? She has more staining than usual, but Crest and Colgate and Sensodyne and Listerine or whatever, there is no company specific to stain. So that is why C is not the right answer. And D, I love this. So D is not the right answer because why would you talk about ways to quit smoking? Does it mention here that she's a smoker? No. It mentions she has extra staining, but that doesn't mean she's smoking, right? No, it does not. So the board exam does that a lot, where they will throw extra things there in the answer and to confuse you. And students may go, smoking cessation? What? She didn't mention smoking here, but she has stain. So maybe the board exam is trying to trick me and that's the right answer. So they don't try to trick you that much. If the answer makes no sense and it's not part of the question, it's the wrong answer. So does that make sense? So that is why D is not correct because it doesn't say anything here about her smoking. Pick apart the keywords. So the keywords are probably her age, the fact that she brushes with baking soda and water. She always has, but this appointment, she has extra staining. So even if you didn't know the answer, what I like to say to do is to look at every single answer and then say, well, could A be correct? No. Could B be correct? Maybe, or yes, and try to find the best answer that way. Okay, so let's do one more question for everybody because I talk way too much, don't I? So I'm sure you would like to get some studying in, but okay, so number 3. So what is the best statement when referring to clients using baking soda and water to brush their teeth? So again, we're talking about statements here. So A, Listerine mouthwash would be better suited, and remember what I said, anytime they mention a company, it's probably not the right answer. B, baking soda should never be used. Well, that's not true. C, there is no evidence this is effective. And D, senior clients do not need extra abrasiveness. Now, age 47, that's not a senior. So that is why D is not correct because she is not a senior. A is not correct because they're talking about a company and it's just simply not true. And B is not correct because nowhere does it say that baking soda should never be used. But that's a topic for a different day. I don't recommend my clients use baking soda and water because I find it can be quite coarse and it could even take away the enamel slightly. It could make the teeth more sensitive, but every patient is different. But it does actually help to take away stain from what I've seen from my, real world experience. But in this case, we're not talking about that. We are talking about stain, but that's not part of the question. The question is simply, what is the best statement when referring to clients using baking soda and water to brush their teeth? So the best answer is C. So how is everybody doing so far? So I know you guys all love the mock exam questions. I will have some more for you guys tomorrow. And if you guys are part of the Facebook group that I talked about, I do have mock exams on there all the time. So please have a look on my YouTube channel as well, which is, my username is just simply Dentalelle. I do have mock exam videos. So if you want to go over even more mock exam questions like now, I have lots of videos on there for you. So please have a look. And as I also said, for my Board Exam Prep Academy members, we go over mock exam questions at every single session, so at least twice a month. So because I know you love mock exam questions, I love mock exam questions because it gives me a chance to talk about why certain answers are not correct. So I hope this helped. Let me stop sharing my screen here, everybody. There we go. So yeah, so I hope this helped. And next time I'll hide the answers first. So then that way you guys can think about the answers and not know the answer right away. So I will see you guys all later and see you guys in the next video.